Are you worried about dental implants looking fake? I want to talk to you about a couple of things that factor into how teeth match, what materials are used, and how we can get you an excellent result. A lot goes into making a tooth match, the adjacent tooth match your face, blend in with your smile, and look natural. At Trident Dental Implant Center, we use top materials. We have an understanding of aesthetics and how things appear natural and how things function well. So we can combine all those factors to get you an excellent result that doesn't look obvious, that doesn't look artificial, and blends in with your appearance. So I want to talk to you about a case where someone came to me and they were very concerned about damage that happened to their front tooth and what would need to be done to make it look natural and blend in. Of a young lady who had some issues with a front tooth and came to me seeking an option of the best course of action and how to replace that front tooth. So we can see her smile here. She's had some dental work in the past. And as we know, it's hard to match new dental work to existing dental work. There's a lot of color science that goes into it. There's a lot of material science that goes into it. And we need to have an understanding of how things match and how things align, how things fit together, and how to get that excellent result that doesn't look obvious or fake for you. So we take a look at her smile here. We see a little bit of chipping in this tooth, on this crown as well, and a little bit of chipping here. But this tooth right here is the one that's in question. So let's take a closer look inside of the mouth. And again, this is the tooth here that we're looking at. This is the tooth that was damaged. It was causing her some pain. It also felt a little loose for her. So she came in to see us right away, which is the best way to go. And when I was taking a look at that tooth, I saw a red bump here, right at the tip of where that tooth is underneath the bone. We took some x-rays, we investigated what was going on, and we found that that tooth unfortunately had a crack and it needed to be removed and replaced. So we talked about a couple options and we decided that an implant was going to be the best way of replacing that tooth. Now that brought up some concerns for this patient because if you take a look here, this back tooth had also been replaced with an implant. And we look at the length of that tooth, look how long it is compared to the tooth ahead of it. You can also see here that there's some gray metal showing at the base of that implant. So this patient was rightfully concerned that her front implant was going to look just like the back implant, but we were able to get her a really good aesthetic result based off of a few conditions that were existing, that she had healthy bone, that we were going to address the issue as early as possible, and that we didn't wait a long time for bone to shrink and for gum tissue to be lost. So here's the first step of that treatment. We can see that the tooth has been extracted. We can see some white stitches here, and we can see this material here. That's called a membrane, and that covers up the area, the hole where the tooth used to be, and underneath it, in about this area, there's bone graft material. And that goes in as little particles. They look like grains of salt or grains of sand. So the membrane and the stitches hold everything in place. Here's another angle of that same site. Again, we see the membrane here and some stitches holding everything in place. When I did this extraction, I was intentionally very delicate in taking that tooth out. Sometimes damage to the adjacent teeth or the existing bone can be done when a tooth is taken out. And that just gives us a lower quality result when we come back to place that implant. In certain situations, we can place the implant right away. In this case, I wanted to preserve as much gum tissue and as much bone as possible. So we took a slower approach, a more cautious approach, and spaced things out and allowed the body more time to heal so that we got that excellent result that our patient was looking for. And here's the result after everything is healed. And we have beautiful gum tissue here, nice, thick, pink gum tissue that's next to those teeth. We have a nice contour to the gum tissue that's there. But being that this patient, we can see here, had a little bit of gum disease, a little bit of bone loss around these existing crowns, I wanted to take an extra precaution to make sure that this didn't happen in the future and that there wasn't more gum or bone loss, what we call recession, that made the parts and pieces of this dental treatment visible that you can see here outlined. So we can take another look here at the top view. Again, we can see nice thick bone and gum tissue here. It matches in. There isn't a large divot. That probably would have happened if we waited a long time, if we didn't do a bone graft, or if we didn't take the next step. And here's a view of that next step. We can see here we have the healing cap or the cover of the implant that's coming out through the gum tissue. And we can also see a couple stitches here and a small incision that I made. And I put a graft material underneath the gum tissue here that actually plumps up and thickens that gum tissue there, so that in the future, if gum disease happens, we got some nice thick tissue that's more resistant to that process. And so the implant doesn't lose the pink part of it that covers that gray metal that's underneath there. And here is the implant after the implant has healed. We can see no more bleeding, no more nice healthy gum tissue around here. We can also see that up here, we have beautiful thick gum tissue. And actually, we would like to see these little dots in the gum tissue. That tells us that that gum tissue is really healthy. Here's another view from the top. We see this healing cap. We call it a healing abutment. And basically, it just covers the access to the implant. We can remove it when it comes time to making the final crown for you. But we look at the shape of that gum and bone tissue there. It's nice and flat. It follows the adjacent contours and has a natural appearance to it. So when it came time to make the final crown, I made what's called a custom abutment. And then we can see that here, that's this gold piece that sticks up underneath. Now, why is it gold? If you look at the natural tooth structure that's appearing here underneath this crown, it has that similar color tone. It's in the same color palette. It's an orangish, yellowish color. So that gives the tooth a more warm and natural appearance when we come to put a crown on it. The other option that we have versus gold is a gray metal, which isn't a natural color and it doesn't blend in well. It makes making that crown blend in with everything else much more challenging. Here's another view. We can see the filling material that's inside of that custom abutment, and we got a top view of the custom abutment along with the adjacent teeth. And here's a smile view of that finalized crown. Again, it's this tooth. It's a little bit hard to tell which tooth was done. And we did that intentionally. We want things to be natural, we want things to blend in, and we don't want you to have an obvious artificial dental treatment. Here's a view inside of the mouth. Again, we don't see any of those parts and pieces showing. We have a nice crown that fits in with the adjacent teeth as far as shape, size, color, as well as the biting edge too, so that things are harmonious and pure natural for you. And here's a more direct photo of that front crown. Again, beautiful coloration, nice match as far as shape, size. As a comparison, the before, we see kind of a white, more artificial looking crown here versus the very natural after photo. These are the type of results that I like to deliver to my patients, focusing on getting a really good outcome that's natural, fits your desires, fits your face, and is appropriate for you. So I think the worry that dental implants may look fake comes in a situation where they may not be done appropriately and when there's a lack of attention to detail. So we try to do excellent care at Trident Dental Implant Center and get you the best possible outcomes like these. Thank you.